Good day, everyone. I hope this video finds you and your loved ones doing well and staying healthy. Our mission at WRHS is to provide the care that you need. During these times, the needs of our nation and community have changed in some ways, but remain the same in others. I want you to know that we are here to meet all of your health needs. From care for your children, to care for your parents, and care for yourself. We are here for you. While the current coronavirus pandemic has created challenges for our society and healthcare, we have been diligent to plan for your care with the utmost safety and precautions in mind. We are here for you, and we are here to meet your needs with compassion and the utmost level of safety to you. The most qualified people to talk about how we will safely care for you during these unusual times are the people who provide you care at the highest level, your doctors. Several local doctors volunteered to make a video to talk directly to you about how each of them and our entire health system are here to provide care for you. 4 local doctors who have years of experience caring for our communities will share with you in this video, and I'm pleased to introduce them to you now. First of all, Dr. J.D. Allen is an orthopedic surgeon and a longtime member of the community. He's loved and respected by his patients and fellow physicians. Dr. Doug Bernard is a family medicine physician and chief medical officer for the health system. Before becoming the CMO, Dr. Bernard had a tremendous practice caring for families. As CMO, he's helped lead our efforts in preparing for and overcoming the coronavirus. Dr. Amanda Smith is one of the pediatricians who cares for the children in our communities. She is caring and compassionate and is terrific with parents and kids alike. Last, Dr. Kip Baker is an emergency room physician. Excellent physician, leads our emergency department, and I'm confident he'll bring some helpful information for you. Please keep in mind, this video is a little longer than most of the ones that we share with you, but it will be well worth your time. It will answer some of your questions, provide good medical information, and put you at ease.
I'm Dr. J.D. Allen. I'm an orthopedic surgeon with White River Health Systems. I've been in practice here for almost 40 years now, which is a little scary. My partners, Dr. Jeff Angel, Dr. Dylan Carpenter, and Dr. Wes Greer, are all board certified orthopedic surgeons. We've been in practice together now for, Dr. Angel and I, for over 20 years, and Dr. Carpenter and Dr. Greer are recently joined our practice. We do general orthopedics. And I know that in times like now that we are going through the coronavirus epidemic, everybody's concerned about getting out, about going to the doctor's office, about going to the hospital. And I wanted to touch on some of the things that we're trying to do to make it safer and certainly more hospitable for patient care. Our office is right across the street from the hospital, and we actually meet our patients. We have part of our staff meet the patients in the parking lot, interview them. They don't come into the building until about 5 minutes before their appointment time. They are screened for temperature, cough, malaise to see if the patients feel bad. They're asked if they have been exposed. We encourage the use of masks. We would certainly like to see everybody that comes in to wear a mask, not because we know that there's a problem in the building, but because we don't know. And that's one of the things I think the fear factor right now is high, because everybody wonders who's got it and who doesn't. And I think that that's a real concern and should be. But I promise you, in our office setting, we don't let more than, I think it's 8 people in the building at the same time. They're spaced at least 6 feet to 10 feet apart, and they're seen promptly. We really don't have a long waiting time in the office. So I think that we're doing all the things that we need to do, and certainly the things that are recommended by the CDC to make patient care safer, particularly from an office care standpoint.
Hello, my name is Doug Bernard. I'm the Chief Medical Officer for White River Health System, and I've been in this current role full-time since 2015, and prior to that I've been in practice in Batesville with a generalized family medicine practice. My current role at the hospital, in addition to being the Chief Medical Officer, is I oversee essentially the evidence-based care that we provide for our patients. I'm also medical director of our inpatient rehab unit as well. And very proud of our hospital. We've been going through, as everybody out there has been, this COVID crisis, and we were very fortunate to get on top of this early. I think our health system, all of our partners, our employees have done an outstanding job of not only protecting our patients, but protecting themselves and also protecting our communities. Recently, we have been started elective procedures, limited elective procedures for certain groups of people, and these guidelines were given to us by the Arkansas Department of Health. If you were somebody that has an elective procedure plan, what would happen is we would ask you to come in at least 2 days before, preferably 1 day before, to have a COVID test, which we will be able to give those results to your surgeon. If the test was negative, we would have you come in on the morning of surgery. You would still be temperature checked. We'd ask you to wear a mask when you come in, and you would keep that mask on throughout your stay in the hospital, other than when you were having the surgery done. So you will be screened both for when you come in for a COVID test, and you will temperature screen then, and you'll also be temperature screened with a mask when you come back in on that day of surgery. And then our goal is to make sure that any of these surgeries that we do, the patient is going to go home on the same day. That is a directive from the health department. We don't expect any complications from surgery, so we try to keep the surgery limited to something that we can ensure that you're going to go home the same day. As we're starting to see our society begin to slowly open up, and I do want to encourage everybody we need to take this slowly, because I do feel like this virus is going to be around for some time, and that doesn't mean we can't deal with it. I think we're dealing with it as well as can be expected. Many people still have chronic medical problems. We don't want you to avoid going to the doctor or avoid using our telemedicine service, but there are times when you have to see your physician, and we don't want you to not go to the physician, because again, we have processes in place to not only protect you but protect our staff. Same thing with the emergency room. We've seen some of our emergency room volumes drop, and I understand that. We're starting to see them pick back up a bit, so if you're having symptoms where you need to see a physician, if you can't make it to the office, we are open for business at the hospital. We will see you in the emergency room just like we always have, and I don't want anybody to delay a medical problem because of concerns for COVID. It's just that simple. We are prepared to take care of you, and we are open for business 24 hours a day, 365 days a year.
Good morning, my name is Dr. Amanda Smith. I'm one of the pediatricians in the children's clinic with Dr. Moody, Dr. Chinayan, and our nurse practitioner Tyler Sandlin. I started here in September of 2019, so I've been here almost a year now, which doesn't seem possible. And I grew up around Batesville. I went to Southside High School. I graduated in 2008 actually. And I live in town now with my husband and my daughter, who just turned a year old. We have one dog. His name is Bandit. And, just kind of getting reacquainted with the community. And right now we are still seeing patients at the children's clinic. We have a designated sick team and a designated well team at this point. So what we do whenever parents get here, we have them call from the parking lot. And then one of our nurses will call and do intake questions. If you're on the sick team or if you have a sick child, we have you pull around back. We have numbered parking spots, and a provider will dress out in full PPE, including mask, face shield, gown, gloves, and we'll come out and see you in your car. If you have a child here for wellness, the nurses call and do all of the intake questions over the phone, and then we have you come to one of the doors to the outside. Our waiting rooms are closed, so they give you directions to come through one of our outside doors, and they take your temperature upon arrival and give you a mask if you don't have your own. and then a provider will see you in clinic.
My name is Kip Baker. I serve as the Medical Director of Emergency Services here at White River Medical Center in Batesville, as well as the Medical Complex Emergency Department in Cherokee Village. My background and training is I was trained in emergency medicine at UAMS. I am board certified by the American Board of Emergency Physicians. Certainly if you're in a high-risk category, and I mean people over the age of 50 years old, certainly younger than that, if you're having chest pains and you have a positive family history of people in your family that's had heart-related illnesses, we're always encourage you to seek medical attention and medical evaluation. People that have known coronary artery disease, atherosclerosis, any type of difficulty speaking, weakness in extremity, difficulty walking, or had any type of trauma, to always seek evaluation in the emergency department. Right now the policy that's in place is we're not allowing visitors. Of course there are exceptions to that. If you're a minor, of course, your parents, the parent of the minor will be able to accompany the child. Also people suffering from critical illnesses, and it's really on a case-by-case basis, but right now no visitors as of right now, and I think that policy is constantly being reevaluated.
Thank you for investing your time to watch this video. I hope that it has provided some information and answers for you. Our goal is to provide you high quality and safe care. Our desire is to be here for you. If you have any questions, please reach out to us at 262-6149 or on our website at whiteriverhealthsystem.com. Thank you so much. Have a blessed day.